Welcome. My name is Tiffany Mason, and I am the Tobacco Use Prevention Education Curriculum Specialist at Contra Costa County Office of Ed. It is a humbling experience to be here with all of you, and I'd like to be the first to personally thank you for joining us this evening. We know your time is valuable, and we are excited you are spending some of it with us. Before we get started with the presentation, I would like to review a few logistics. You may have noticed that this presentation is being recorded. However, all attendees are muted and are not on video, so you don't have to worry about making an appearance. Also, the webinar recording will be made available to everyone via email following the presentation, so you will have access to the information shared today. We ask that you please utilize the Q&A box. Submit your questions there. We will monitor the Q&A box throughout the presentation, and we will respond directly. However, we also have a Q&A time following the presentation this evening, so feel free to ask questions at that time as well. We appreciate those of you who submitted questions during the registration. All questions were reviewed and many answers will be provided within the presentation. We will utilize the polling feature during this presentation, which will allow us to gather anonymous feedback from you all. Lastly, we will provide key resource links via the chat box and at the end of the webinar. We are not able to access them through the chat, but if you are not able to access them through the chat, don't worry, because we'll send them out to you via email following the presentation. Before I pass things off to our amazing presenters, I want to provide a bit of information about who we are and what we do as I introduce tonight's speakers. Tobacco Use Prevention Education, or TUPE for short, is a program under the Student Programs Department at Contra Costa Office of Education. Our goal is to prevent and reduce tobacco use among young people, including some of the newest and most popular tobacco products on the market, e-cigarettes and vape pens. Our team works alongside 18 school districts in our county, as well as provide direct services to students in our county's office programs. Our approach is comprehensive, and it includes classroom-based prevention programs in participating middle schools and high schools, support for those currently using tobacco, program and activities that engage young people as our partners in prevention, staff professional development, and family and community engagement, which is what brings us here tonight. Now I have the honor of introducing our speakers. Our speakers tonight are April Rivero, founder and executive director of National Coalition Against Prescription Drug Abuse, Brian Gleason, program manager of Mothers Against Drunk Driving, and Richard Ceballos, project co-director of Stanford Tobacco Prevention Toolkit and Cannabis Awareness and Prevention Toolkit. We are grateful to have them presenting this evening to share a wealth of information. We also have the privilege of being joined by 3 members of our Contra Costa County Courage Youth Health Coalition. Cece, 10th grader, Drew, 11th grader, and Genevieve, 11th grader. A quick overview of Courage is, it is a youth-centered and directed group that plays a leadership role in addressing health-related issues. Members in grades 8th through 12th represent communities across our county. We value and appreciate youth perspective, and we feel very fortunate to have them here this evening. Again, thank you all for joining us. This evening, we will begin with learning about alcohol, cannabis, and prescription drugs, followed by some tips for adults and sharing some resources. We will end the evening with an optional Q&A session. However, feel free to enter questions into the Q&A box at any time throughout the presentation. Now, with all of that said, I would like to start with a little audience participation. As you can see, there's a poll that's up, and the question is, I am attending this event because, and if you can go ahead and place your answer in the poll, that will be great. Give people a few more seconds. After we have a few more responses, we will then post the results. And it looks like there are mostly people here that want to learn about substance use and teens. So thank you for attending tonight. And at this time, I will pass it along to Drew, our Courage member.
Thank you. So the question I asked with panelists tonight is, what do parents and other adults need to know about alcohol, cannabis, and prescription drugs in young people? Now, with my experience with these drugs, I have seen multiple times that these are a major issue. A lot of the times, people joke around quite a bit. I remember hearing a joke at one of my prior schools: flip a coin. If the coin is tails, that person probably vapes. And I think that probably gets you a good scope of how much of an epidemic is going on with this. I mean, vaping is commonly, there are so many misconceptions about it and just almost straight up lies being thrown out at times that to many teenagers, it can almost seem like vaping is a very safe alternative to smoking. Same goes with cannabis use. Many young people do turn to cannabis. I have seen quite a bit of it myself. And it also is mainly fueled by a lot of people just not knowing the true facts about what goes on with these drugs. Simply thinking, oh, they're just a safe stress reliever, when they actually do a lot more harm to your body. And now, let's hear from the presenters.
Well, thank you, Drew. I really appreciate you, and I kind of feel like I just want to turn things over to you. I'm here as an expert panelist, but I feel like maybe you're more of an expert than I am. So thank you for that. And we're going to talk briefly about each of these things. We've only got a few minutes to do that, and so we're going to give you a high level, hopefully helpful understanding of these topics, and our information will be at the end, and we'll give you some resources as well, but please reach out to us. And so as we talk about alcohol, which is why I'm here, alcohol is a drug. It's still a top choice of teenagers, depending on what surveys you look at and where you look, whether it's the Safe and Healthy Schools or the national surveys that are done. It varies by area, but the average is 15 to 20% of California high school students said they drank alcohol in the last month. Some areas that number is much, much higher. And so it is still something that teenagers are choosing. And we've seen an increase, especially in this time of COVID, of binge drinking, where high school students in particular are drinking large quantities of alcohol at one time. And so we've seen the impact as well. And teen alcohol use kills more than 4,300 youth each year. Here in California, we saw 503 of those deaths in 2018 alone. And those deaths come from everything from traffic deaths to alcohol poisoning to other accidents, Recently heard of a story of a college student who fell down the stairs because he was intoxicated. And so we see these accidents happen on different levels, but unfortunately, we're seeing a lot of deaths come due to alcohol use. And alcohol is a depressant, it's addictive, it lowers people's emotions and reduces their nervous system activity. And so it is something to be taken seriously. If we can move to the next slide. When we talk with middle school and high school students, we try to emphasize with them, and we spend a good deal of time talking about when they decided on 21 being the legal age to drink. That wasn't just a random number that they pulled out of a hat, or they weren't thinking that's when people are responsible enough, that it really has a lot to do with brain development. And your brain isn't fully developed until your mid-20s. And when you input alcohol into that, it stunts that development, it affects that development, and that is a major reason to wait. But we also see other physical effects as well when it comes to alcohol use in teenagers. I want to point your attention to a great resource. It's called Substance Free Athletics, and the graphic you see on the screen right now is from them. They deal a lot with teenagers and athletics, but the impact you see here on the physical side of things, it also translates to other students as well. And so drinking alcohol affects your metabolism, it slows it down, your endurance, your cardiovascular system is impacted. It makes it really hard to maintain weight, gaining or losing weight. It affects your nutrients and how your body absorbs those nutrients, which affects everything from muscle repair to, again, your endurance and your risk for injuries. Sleep is impacted as well. Hydration is a big thing with alcohol use, that when you're drinking alcohol, it affects your body's ability to rehydrate. And then your performance as well, and injuries. So we see a lot of injuries due to alcohol use, especially when we're talking about athletics, but we see that across the board as well. And so these are just some of the physical effects. And when I talk with teenagers, I do like to emphasize that basically every part of our body is impacted by alcohol consumption. So we'll talk a little further about what to do now as parents, but this is some of what we want you to be aware of when it comes to alcohol use in teenagers.
Okay, so now we're going to switch over to talking about cannabis. Drew, thank you for the introduction. I think it's really important to paint a picture from the youth perspective. So I want to start with talking about what we mean when we say cannabis or marijuana. I'm specifically referring to THC, so that's the psychoactive ingredient in cannabis that gives the buzz or high. And I want to pay attention to this particular chemical in cannabis because there's a lot of research behind the damage it does to the developing brain. But let's paint a picture of the landscape here of cannabis products because a lot has changed. So as adults, some of you may have seen this growing up, but there are bongs and water pipes. So this is not just from what you've seen in your community, but also just in pop culture. And also another cannabis product we may be familiar with are joints and blunts. And the difference between the two is that a blunt is rolled with a tobacco leaf. So not only does it contain THC, it also contains nicotine, which provides a buzz, but is also addictive like THC. So I'll talk a little more about that later, and it's going to focus mainly on cannabis, but there's bits of information that you'll learn about tobacco as well. So the landscape has changed, and I think a lot of this has been driven by legalization. So now there's this new market for different types of products, and what these products are offering is way more THC, which is showing that these companies, these new cannabis companies, are really trying to addict or get people to be dependent on their products. More THC, if someone's using that, they're more likely to continue using it. So these newer devices, such as a wax pen and shatter, wax, or dabs, they're basically these highly concentrated extractions. And what I mean by that is they're using a blowtorch to remove the THC in these very concentrated amounts. So the wax pen that you see here is not safe to use. It produces not a water vapor, but actually something called an aerosol. And in the summer of 2019, we actually saw cases of lung injuries from using these products that had THC. So I'll talk a little bit about EVOLI, which is e-cigarette or vaping product associated lung injury on the next slide. But these products are not safe to breathe in. Oh, if you could go back real quick, Marissa. Thank you. With these newer products, if you're inhaling THC, you can do damage to the lungs. Now, you may hear some young people ingesting THC, so that's what you're seeing at the bottom with these edible products. This is pretty different from what we may have seen from growing up. If you're an adult, you may have, the thing you think of right away is maybe a brownie or a cookie, but now there are newer products on the market. And the problem with ingesting THC is that there are multiple steps to having the THC shuttle to your brain. So it may not hit you right away. And that's why some people have to be rushed to the ER, because it hits them all at once. And if they use too much, there's really no going back at that point. You can have a terrible psychoactive experience from using too much, and it can lead to poisoning. Also, I'm not going to talk too much about the tinctures, but it's just another way of getting THC to be in a solution or liquid, and people will ingest it that way or put it into their coffee or other food items. But this is what we're talking about. There's inhalation of THC, ingestion of THC. Both of them have their health risks, and I always tell young people that if you're thinking from a harm reduction perspective, even if you're offered THC, you have to remember the younger that you use THC, the more damage you can do to your brain. The more concentrated the THC product is, the more damage you can do to your brain. And also how often you use is you can do more damage to your brain. So there's different ways of reducing that harm. You can, if someone is already using, tell them to consider using less THC, maybe use it less often, and then wait too. If they are really curious or if they are starting to use, it's good to send that message of, hey, your brain is developing, let it do its job, and then rethink this later, okay? Next slide, please. So there are a lot of numbers here, but the main takeaways is that since 2018, there's been a steady, you'll see there's sort of a steady usage across young people. So there's this idea that because of legalization, there's going to be this huge increase in young people using, and there's actually no evidence or no data that proves that. So my point here is that yes, young people are using, and yes, it is a concern because we don't want them to do damage to their brain. But a lot of the times there's two camps of thinking. People think that cannabis is evil and that legalization is going to cause young people, every young person to use it. That's not true. But then there's the other side where it's like cannabis is the solution to all our problems. And that's also not true because we don't know all of the health effects of using this long term. So just the main takeaway from national data is that young people are using. You'll see that 12th graders are using a little more than 10th graders, and 10th graders are using more than 8th graders. But you don't have to come into the conversation saying, oh, everyone's using because it's been legalized in California. There's no evidence to show that yet. And just one more point about EVOLI. We learned about some of the deaths that occur from alcohol. And when we're thinking about vaping cannabis, like I said, when the lung injuries, there's an outbreak of that, we had about 3,000 deaths, and the youngest death was age 15. So this was just an example of how a chemical in those wax pens or those vape pens could cause injuries to the lungs, which usually doesn't happen right away. It takes a long amount of time for that to occur. But what was really concerning is that these products cause real damage real fast. So just think about what you're breathing in, and I'll talk a little more about the lungs and what cannabis is doing to that later.
So I'm up next, and last but not least are prescription drugs. And I want to dispel a common misconception that prescription drugs are safer than illegal drugs. They actually aren't. Just because a doctor prescribed them, it doesn't make them safer. As you can see, they can be just as deadly, addictive, and just as illegal. And unfortunately, we do have young people who are able to quite easily get a hold of prescription drugs because not every adult locks them up well. The reality is we need to all be doing what we can to put medicine out of the hands of, or the reach of, young children, because it's not uncommon for little kids to get a hold of those pretty pills and down them thinking they're candy. I even have a friend who almost lost his dog when he got a hold of some some pills that were unattended. So I think of all the drugs we're talking about today, the prescription meds are the drugs that we can see an immediate impact from overdose death. And so we're going to talk about that as we go down the path here, and I'll share with you real quickly which kinds of drugs we need to be super careful with. So next slide, please. This is showing you, based on the 2019 report, basically that we've got about 14% of lifetime use. That is, like any time within their lifetime, a high school student has misused prescription opioids specifically. And so that would be 14, teens out of 100 that have misused opioids. And opioids are very, very dangerous if taken improperly, and certainly when mixed with alcohol and other central nervous system depressants. So also what I found interesting is that more female students than male students had misused prescription opioids. And that was interesting because I know in terms of overdose, the national data has suggested, since I started tracking this 11 years ago, that males actually die from overdose more often. So that was a bit of surprise for me as I started looking into this recently, this particular slide. So if we can advance to the next one. If you can go ahead and touch it again, you'll see that this is the selection of prescription drugs that are both misused by youth and adults for that matter, but also can be the most dangerous. So let me just talk real quickly about each of these categories. So move on to the next slide, please. So starting with sedatives and benzodiazepines, I don't think I've ever spoken at any school where I wasn't told that Xanax in particular tends to be a sought after drug by teens and even into college. The problem with this medication is it's perceived to be just kind of a chill pill. If it's prescribed to someone, it's supposed to be anyway for acute anxiety, and it should be just for a short period of time because of how quick our bodies can become dependent on it, physically dependent. The biggest problem of all these potential side effects, of course, is that as it's working in your system to basically manage your anxiety, it also slows your breathing down naturally. And so again, if you take too much, or if you're combining this drug with alcohol, or this drug with another, maybe a prescription painkiller, or even illegal painkillers, whatever that might look like, you could actually have an overdose that would be basically your breathing has stopped. So we need to be really, really careful with these and absolutely lock these up. Don't let any of these be available to teens or anyone else in your house. So the next slide will be about stimulants. So some of our kids, of course, are taking some of these medications. Their medications are being prescribed for ADD and ADHD. And so we shouldn't expect that these side effects appear in people who are taking them legitimately and with medical supervision. But it's not uncommon for youth to hit up another student, a friend, for an Adderall pill or a Ritalin pill, let's just say, to study for a test. They want to stay up all night, make sure that they, do okay on exams, finals, whatever. They can also be abused, to get a high, just a high period, or also to get kind of an edge on, in a playing situation, a sports environment. So more energy. I've even recently been told that some doctors are prescribing this medication to seniors to give them more energy. And that just really took me by surprise. That was about a month ago when I heard that one. And I was really pretty much abhorred by that, because heart attacks can happen. Any of these side effects that you see here are possibilities. So I always caution kids not to share their ADHD medication. Sometimes other students are even willing to buy it, of course, and you don't want to do that, for the medical potential as well as the legal potential if you're selling or giving your drugs away. So next slide, please. Cough medicine, cold medicine comes in two forms. One would be over the counter. So you just go into a drugstore and you can pick that up. But it has alcohol in it, which of course, you can get a bit of a high from if you drink enough of it. Usually we're just taking a spoonful of cough medicine. It doesn't taste that good and you don't want to drink a lot of it. But the kids are mixing they're mixing soda, they're adding different kinds of candies to make it taste better so it's more tolerable. The cough medicine you get prescribed to you has codeine in it, and codeine is an opioid. That's the cough suppressant element of cough medicine. And of course, that has the potential that all opioids do. I do know kids that have actually passed away from cough medicine abuse, so it's not unusual, but other things like the side effects that you see here are probably more common. Okay, moving on over to the next slide. We've got prescribed opioids. So as I mentioned before, we're really seeing more opioid overdoses than any of the other prescribed medications. These are potentially very dangerous. And they can also lead to illegal opioid usage that I'll talk about in a little bit. The samples that you see here, these are just a few samples of what is out there. There are all sorts of different variants of painkillers, and it can be hydrocodone, which has any of those prescriptions like Vicodin actually has Tylenol, acetaminophen in it. And if you become addicted to Vicodin in particular, any of the hydrocodone products, you can actually damage your liver severely enough to have a replacement necessary. So anyway, all of these different things are really important to tune in on. The short term, understanding what an overdose looks like is really important. Thankfully, there is an overdose remedy we'll talk about in a little bit, but this would be a pretty good capture of what you need to worry about short term and long term. So I think that's it for my slides.
Okay, so why is it important for parents and other adults to understand this issue? Well, increasing your knowledge as a parent and adult can be a key step in understanding the environment kids are growing up today. It can help open the door for crucial conversations about stress and mental health, and even having this knowledge can build trust in these relationships with young people. They can turn to you for advice, correct information, and even safety concerns. I know that personally, many of my peers would feel ashamed to talk to their parents about this issue, and some may even feel isolated as they navigate this world by themselves. Many are getting the wrong information from friends, and it just adds up to the dangerous situations that kids are being exposed to. But now let's hear from our presenters who will dive into much more detail.
Okay, so it's back to me again. So one of the things I think is most important is that if our young people, and anyone in fact, gets addicted or forms an opioid use disorder to opioids, which is taking more lives in terms of overdose than the other medications, as I mentioned, it's not uncommon for them to move over to the synthetic and the illegal form of opioids that you're seeing here. So heroin is out there, it's very prevalent. It's very available. It's super cheap compared to prescription opioids. And that is the case also for fentanyl. You probably heard about the opioid epidemic that's getting a lot of press right now. And a lot of it is being driven by fentanyl that is 50 to 100 times more potent than morphine, which is kind of the measurement that is used to determine how strong the different forms of opioids are, including prescription drugs. As you can see in the penny that is down in the lower right, just that amount, that small amount of fentanyl is enough to kill somebody. You can also inhale it if it becomes airborne, and you can overdose from that. Also, we're seeing pill mill factories per se forming these fake pills out of fentanyl. And they can look just like the real thing. I work with law enforcement a lot. And they told me consistently that they can't always tell the difference. They have to run it through a lab to see if somebody's actually got fentanyl on them or a real pill. So the problem is too, we're seeing fentanyl being basically factored into almost any drug out there on the street, any of the illegal drugs. So we're finding it in heroin, we're finding it in cocaine and methamphetamine even. And unfortunately for the homegrown marijuana, it's easy enough to sprinkle some of this stuff in there too. And when that happens, the drug that you're taking in is just extremely potent, and it can easily take a life. So that is what I want, our parents to know is like, you need to counsel your kids. You need to talk to them. they need to understand that these drugs are out there. Most recently, I don't know if anybody follows Dr. Laura. She's a radio personality that's been out there for a lot of years, and she just lost her 16-year-old son, I believe that was his age, to a fentanyl-related overdose. And it was pills that he actually got from through a contact he made in TikTok. So we've got these social media platforms that we really have to be on alert for to make sure that drugs aren't being made available through those programs. And I'm sure that's not true just of the prescription drugs or fentanyl and that sort of thing. It's probably true for any of the drugs. They can get a hold of it. If kids have a credit card, they can also go online. There are a lot of fake pharmacies online where they can go and just order what they want. And a lot of times what arrives is fentanyl-based products. So that would be something I want everybody just to be really tuned into. These drugs are pretty much available in any community. None of them are immune. And it's because it's so cheap. And those, again, that are either looking for a big high or otherwise they have established an opioid use disorder, are very likely going to encounter fentanyl. So let's see if I think we've got another slide to follow here that talks about, yeah, okay, I'm sorry, that's it for me then.
So some of why we think this is important for parents to understand is, believe it or not, 3 in 4 teens say their parents are the leading influence. I know those of you that have teenagers may question that statistic and how much they're listening to you and everything, but we have seen that play out. And so we like to focus on 2 areas, really. What you say matters. So being willing to have those conversations and not just make assumptions that your teen may already know the information that they need to, but to be willing to have the hard conversations and really engage them in the process of having talks about alcohol and how to deal with alcohol consumption, and whether it's conversations on their own personal use, but also their friends as well. And then what you say or what you do matters as well. Teenagers, they see what you're doing, they see how you are treating alcohol. And so we want to make sure parents are aware of that as well. I just recently had a conversation with a high school student who was prepping to help me do a presentation. And when I asked him, what would you like your parents to know about teenagers and alcohol, his first comment to me was, I see what you do, I see how you handle alcohol, and it has an impact on me. And so we just want parents to be aware of that and know that their teenagers are watching them, and that they can be a positive role model, a positive model of how to treat alcohol and how to drink and how to really prepare for that as well. And so there's all these misperceptions about each of these drugs and the alcohol that we're talking about tonight. But we've seen with alcohol that we have a lot of parents who will say, I want to let my teenager drink at home because it'll take the mystery away from alcohol, and it'll decrease their desire to drink when I'm not around. Or parents that want to provide alcohol to their teenagers for special occasions. And probably the most common thing I hear from parents is, well, I drank when I was a teenager, I'm all right. Or who am I to say to my teenager now they shouldn't drink at all? And we've seen it play out with each of these things, that the research shows that as you drink at home, you drink more as a teenager, you drink more often. You have more problems. You end up dealing with alcohol issues down the road as well. And to that point, I want to address specifically of adults that say, I drank when I was a teenager. How am I supposed to have that conversation with my teenager now? And I would just like to encourage you to be honest and upfront with your use, in appropriate ways, obviously, but to be upfront with them, to talk about the consequences that you encountered. But also to realize that we've learned a lot about alcohol use and these other drug uses over the last 10 years, over the last 5 years even, and how they impact us. And so knowing that and having that knowledge, it's a conversation of things have changed, and we do know now that this has a deeper impact that you weren't aware of when you were a teenager possibly. And so really entering into that conversation, like I said, being willing to be honest about it and to be upfront with your teenager and to give them the tools to then go and make the right choices as well. So these are some of the reasons why we think it's important for parents to understand. Going back to earlier, as I was talking about how many students are using and everything too. I think that's a big part of this conversation as well, to be aware of all those things so that you can have those honest conversations with your team.
Okay, so let's talk about some of the misconceptions around cannabis. And I want to start from the top. So a lot of the times we're told that cannabis is natural, that it's been around for 10,000 years, and a lot of cultures have used cannabis. The only problem is the cannabis industry has manipulated the plant to produce more THC, which is the chemical that gives the buzz in the plant. And the problem is that there are so many steps now to cannabis production with the newer products that it's not natural by the end point, by time it's ready to go to the dispensary. And that is really important to know, because with the manufacturing process comes a lot of additives, other chemicals that go in there that we just don't know what the long-term health effects of using those are. So it's really important to break that down if someone says, hey, cannabis is natural. And another thing to consider is everything that's natural is not going to be safe to use, and there's not going to always be research to back up humans using that, specifically a young person using that for a certain amount of time. The other misconception is that cannabis is medicine. And the reality is it doesn't qualify as medicine, and it's not approved by the government or the FDA for medical use. Now, there are some chemicals that they've been able to use to create cannabis-derived drug products that have been used to help with seizures, like Epidiolex. That's just one example. There are a few others on this slide too. And you'll receive the slides from today, so you'll be able to look at these in more detail. But young people may tell you, hey, cannabis is my medicine, I'm using it to self-medicate. Well, there's actually medications out there that you can be prescribed by a healthcare professional if you're experiencing anxiety or you're experiencing depression. So a lot of times young people are going to cannabis because they're looking for that quick fix. They want to feel better, so they're trying to use it to self-medicate. But the reality is you have to talk to a healthcare professional before you're prescribed anything. And that's what I want to echo, is that point today, because you may hear this from someone who is trying to cope with life and they start using this to feel better. In terms of feeling better, sometimes you hear that, oh, cannabis is okay for some young people. It's not good for the developing brain. Like I was saying in the section before, it can do damage to the brain. And the other problem is the activity of using cannabis can be wired in for the developing brain a lot easier than it can for an adult. The reason why is because THC actually fires off dopamine, or the pleasure chemical in the brain. And this is sort of some basic science about addiction and dependence. Once a young person starts to fire off dopamine from a drug, they start to think that it's important for survival, when we know drugs aren't important for survival. So the problem is that the developing brain is hypersensitive to these false shocks of dopamine. And what we do know is that if you continue to use at a young age, like I was saying, and you're using it frequently, you're using a lot of THC, then you can actually wire in that skill of using cannabis to cope with what's going on in life. And we don't want young people becoming adults, and then the only way they know how to cope with life is from using cannabis or any other drug. So that's just a little bit of background on the brain. Next slide, please. Here are just some quick points about the impact of cannabis on young people. So the one I have at the top is mental health. Studies actually link cannabis to anxiety, depression, suicide planning, and psychotic episodes, but we don't know if it's actually causing these conditions. So if a young person says, hey, I feel less anxious when I'm using cannabis, I feel less depressed, well, the studies are actually linking to an increase in anxiety or depression. So there's sort of that disconnect. Even if someone is telling you that, we know long-term that they can actually increase some of these symptoms, or at least young people are reporting, or the studies are showing that they're reporting more cases of anxiety or depression, and the list goes on. Also, in terms of athletic performance and driving, we do know that there's a part of the brain, a small brain in back of, called the cerebellum, and that is actually disrupted by THC. So what that can do is interrupt with your coordination and movement, which is why people who drive under the influence of cannabis can experience dangerous effects. So even though people say no one actually dies from using cannabis, Well, if you're using cannabis and then you start to drive, you're actually putting yourself at risk of getting in an accident and hurting yourself. So yeah, no one dies from using cannabis, except for when we talked about EVALI, and I wish we had more time to go into that. But the idea here is that it can affect and disrupt your brain from functioning. And the last point is just looking specifically at brain health and daily life. So a lot of times if you type in cannabis and effects on the developing brain, and we know from a study in New Zealand that there was a reported loss in IQ points. And even after someone quits, they do not gain those IQ points back. So you can imagine how that can affect or have a domino effect on a young person's life. And also the last point is that research is showing that people who are using cannabis long-term are more likely to have relationship problems, lower career achievement. But the idea here is you don't want to go in and try to scare a young person and say, see, this is what's going to happen if you use cannabis. You want to present the facts and say, hey, I just want you to know all of these facts about how cannabis can affect your brain, your mental health, and the list goes on. So those are just some of the main points you should make sure to include in your conversation with a young person.
May I please add on just a more personal experience?
Yes, please.
So actually, one of my close friends did turn to cannabis use at one point in time to cope with his depression. I remember very clearly him talking about it, and it was shocking in many ways. You know, you can obviously, with a lot of these types of instances, it's not that they necessarily wanted to like try this out to be cool. It's because they were trying to find some way to cope with stuff like anxiety and depression. And in the end, it only made his conditions actually worse. Like after the high wore off, after him talking to me, he felt worse off and even more in a depressive hole than he did beforehand. And luckily, he's starting to take therapy and getting better. However, I think definitely that sort of connection between a mental health issue being the catalyst for cannabis use can actually make the cannabis usage and the mental condition a lot worse in total, even in the short term.
Yeah, thank you for sharing that, Drew. And I just want to say a lot of times parents may tell their young person, hey, we life was tough when we were growing up and we didn't use cannabis. But the reality is young people are living in a very stressful time. They're probably feeling more anxious, more depressed because of everything that's going on. So it's not always a fair comparison to say, hey, you can rough it out. You don't have to use that. No, they do need the support, but it's not always fair to say that what they're going through is exactly the same as your experience.
Okay, hi. So we're going to be talking about what parents and other adults can do to help address this issue. So with alcohol, I think one of the presenters already said that it matters how you present your drinking habits around your peers that are younger than you. Um, and weed, I'm sorry. And with weed, like let them know, like, yes, this is legal in some places, but it does have a bad addition to how your lungs react, and maybe your body might, like, sometimes it helps to calm people down. For others, it freaks them out and will cause them to do things they will regret in the future time. Prescription drugs, you like you when when you're done using them, instead of throwing them in the trash, what you can do instead, so that your child might not be like, well, I don't want to waste them, let me just use them instead. To bring them, I think you can bring them to CVS or a local police station and say, I'm done with these, can you please throw them away properly for me? And being vocal about your concerns about what's happening, because that's the most important thing, is to get your opinion and voice out there. Yeah.
Thank you for that introduction. I want to just echo what Brian set us up for, a lot of great information about best practices. The first one I want to emphasize is just being an active listener. I know I don't want to engage or talk to someone if they're just going to talk all over what I'm trying to say. So it's really important that adults take a step back and maybe ask a question as a way to get a young person engaged in talking about this issue. And also maybe just say like, hey, what are some things you may have heard from your friends or social media or other sources? And it's really important to start the conversation early. Research has shown that the earlier you connect with the person, a young person, and say, hey, what are some of the problems you're experiencing, or what's it like at school? They're less likely to turn to drugs. So a lot of times you as parents are trying to feel empowered, but it's really important to know that, hey, you actually have a lot of tools you can use. Just start that conversation and be that active listener right away. Today, we learned about a lot of the risks associated with these drugs. So it's important to discuss the risks and dispel the myths, right? So if there is something that's circulating around, because now with the age of the internet, we're living with a lot of misinformation. There's a lot of misperceptions floating around. And it's really important to sit down with this information and say, hey, here's a few facts about cannabis. And just because it's legal doesn't mean it's actually good for the developing brain, right? There's a reason why it's set at 21. And set your expectations high and make them clear. So as a family unit, discuss, okay, what are our rules and what are your activities going to look like? And hey, that's great. You told us there were drugs at the party and you called us to come pick you up because you felt uncomfortable, and we were there in a heartbeat. So those things are important. It's really important to set up a culture in the family. And when a young person does do something good, or maybe they say, hey, I use cannabis, but I didn't inhale it, I ingested it instead, but I heard there were less risk associated with that. I'm sorry, but I just wanted to let you know. Then you should praise that and say, hey, we don't want you using that, but we thought it was great that you took that harm reduction approach when you were presented it. So those types of things are really important to communicate. And with all of you being here, you're in some ways starting to participate in prevention efforts. So you're starting to listen to the community to see what efforts are already going on. And if there is something that is offered for you and your young person to get involved, why don't you consider doing it? So both of you can sit and say, hey, do you remember from that presentation they were talking about saying that cannabis is a medicine? Like, have you heard anything about that? So there's ways to get the conversation going by participating and just being active too, the both of you. And lastly, this point was made, but monitor your own behavior. So is there cannabis already at home? Does your young person see you use it? Do they hear you say, hey, I had a stressful day, I need to just go out and smoke? So that's all very important and can increase a young person's risk of using and having a positive view of cannabis. So just remember to monitor your own behavior. And specifically with cannabis, this was something that the research showed last year, was that if you're using, you're going to increase your young person's risk of using and having positive views. Next slide, please. If you do know someone that is struggling with cannabis use or addiction, you can actually contact this line. So I just wanted to provide that if you need more information, or just, I didn't get to talk about this, but support and treatment that's currently offered. And the second point is, if you're really feeling all the information you're learning about cannabis today, then you can actually sign up for our second annual Teaching Cannabis Awareness and Prevention Conference. So we'll actually provide a link to that. But this is great if you're just trying to jump into the information. It's a 2-day virtual conference, and you don't actually have to be there. You can actually watch a lot of the workshops later when you sign into your account. So on Socio. So this is just an example of how to get involved and maybe hear about what are other parents doing, what treatment's being offered, what's the youth perspective, what are young people seeing in the Bay Area. And then lastly, since I work for the Stanford Cannabis Awareness and Prevention Toolkit, you can always quickly, we're just a click away. You can check out our website. We have a lot of great resources on there for parents. It's just a great one-stop shop where you can see what young people are probably going to learn about in their classroom. And then you can also get the information you need so you feel more confident when you're talking to young people about this.
So a big message I want to send to all parents is how important it is to include the discussion of prescription med safety as you have that drug talk with your kids. I think most parents know to talk about tobacco, alcohol, and marijuana, but I don't think that prescription drugs get consistently included in the messaging that goes to our kids. And I would absolutely echo that, demonstrating good prescription drug and drug, behavior yourselves, taking medication only when necessary and making sure you're not basically popping a pill every time something comes along that you think you need to have a remedy for. So those are important things. And then specifically moving over to the next slide, I think it's really important for parents of all, teens and even college students to have naloxone on hand. Naloxone is the generic term or word for this medication that can overturn an opioid-oriented overdose. It comes in different brand names, such as the nasal spray Narcan and also Ibzio. So the different versions of it have the same impact. It can reverse that overdose, even when somebody's really close to death. So if they stop breathing, having this Narcan, especially on hand, our organization actually provides that free to community members because it's so easy to use. There's a nozzle there. You just put that into a nostril and push the little pin up. And even if they're not breathing, it can release the medication into the system. It goes directly into those brain opioid receptors and you end up freeing up the breathing mechanism. So super important to have it on hand. To learn the signs of overdose, our organization has up on our YouTube channel, which is NCAPDA, and a couple of versions of the naloxone training that takes only 5 or 6 minutes to get through, but it can be life-saving because you can learn to recognize what an overdose looks like and then take action. Of course, if you've got Narcan, you're still going to want to call 911 because you want to get the professionals there to take over the situation and hopefully get them to the hospital so they can be examined to make sure they're okay. And if they're not, of course, take care of them. But also if there is a substance use disorder going on, there are, usually bridge programs at most of our hospitals now, or soon will be, to hopefully gently move them into treatment, and that would include adults, of course, as well. Unfortunately, my slide, it looks like I got cut off a little bit, but to get free Narcan, you can contact us. We do have it, but otherwise, a really easy way to get it is to go to www.naloxoneforall.org. So Emily, if you can put that into the chat, that would be great. So have this on hand. Overdoses happen everywhere you turn these days. It can happen in a public setting. I carry it in my purse when I go out. I have it in my cars just in case, because every minute counts when somebody has stopped breathing. So the next slide, please. Action you can take, everybody can take, is just to continue the education process. There's a lot of things in the news, if you just tune in, about the opioid epidemic, but just prescription drug safety in general, and then managing those medications. So Sissy, thank you so much for mentioning the need for us to get rid of the medication. First of all, if you have them in your house, you need to lock them up. And then you're absolutely right. The proper place to go to get rid of your medication is any CVS in Contra Costa County, and I'm sure over in Alameda County too. Most other places in other counties, I think CVS has been really good to roll out these kiosks where you can just drop your medications off with no questions being asked. And then Safeway in our county and in Alameda County has just installed some new boxes also. They're typically around the pharmacy area. So if you go into the pharmacy counter, you can ask if you can't find it. Sometimes they have them hidden in a corner, but they're there. And then you don't want to throw them in the toilet or down in the trash or whatever, because the medications end up in our water system. So environmentally, we want to use these proper means of disposal. And that can also include, a lot of our police stations aren't open right now to public traffic, but most of them do have these bins also. And they don't ask any questions. You just walk in and again, just dump the meds in their bins. So moving over to the next slide. From this point on, I hope you'll know that it's really important, if you don't already know, to ask questions of your doctor. Just don't blindly take a prescription. Really do some research and make sure you understand what the side effects are. Be on alert for them. And if you start to exhibit some of those, you're going to want to, push back on the doctor and see if there's another solution for you. You always want to make sure that you ask if the medication's addictive, and if it is, and especially if you have a family history of addiction or substance use disorder, let's see if we can find another solution. You should be exploring that with your doctor. Next slide. And these are the resources I wanted to point out. Great parent resources at the Partnership to End Addiction. They actually have some counselors available that are parents who've been through substance use with their own children in the past, and they've been specially trained to really counsel parents. And I can't say enough about their work. They do a great job. And then, of course, the SAMHSA hotline that's already been shared. And NIDA for Teens is also a great website, not just for teens, but for adults too. You can get some really good information on that site. They approach, drug use from a scientific perspective. And so you get a really good look at those things that many of the other speakers have shared, how substance use can be stimulated and how to address it and all that. So that is it, I think, for me, other than our contact information. So be sure to connect with us if you can. We're up on all the different, I don't think that we're not up on Snapchat yet, but just last week we signed up with TikTok. And that's because, again, we have a lot of drug messaging going on there, and we wanted to counteract that. So yes, thank you. ncapda.org. And those email messages come directly to me, as well as any phone calls. So I'll be happy to respond really quickly. And if you need Narcan, again, Naloxone for all, or otherwise, we do have some kits available too. Thank you.
And a lot of what I'm about to say is Richard hit on at the beginning of this session. I promise I didn't steal his slides and just repeat this, but it's great to be to repeat it again and to just reiterate this as well. Again, talking to your teens, we want to encourage you to do that. To give you some tips, I know that can seem a little overwhelming at times, and so just to encourage you to choose your time wisely and avoid distractions. Conversations can be hard enough to handle in this type of conversation as well, but just to making sure that you limit the distractions. And we like to encourage people to use questions and use how would you handle this if you were put in this situation? How would you talk to a friend? How and what and why? What would you do if you were at a party and alcohol was present? And why do you think your friends might be drinking alcohol, or why do you think your peers might be wanting to try that? And to approach the conversation that way. Also to not make assumptions of what they do and do not know. I know, not to throw my parents under the bus, but I know that they at times assumed I knew things, and then we'd have the conversation and they're like, oh, I did not know that you didn't know that. So just to make that clear with them, and really important to communicate your own family values and consequences. I think Richard talked about that a little bit too, but why is this important to you and to the family, and what are the consequences if something does happen? And then we hit on this already, but again, modeling healthy habits as an adult. What are your habits? Communicate to your teens, and to be willing to break your routine. If every gathering, social gathering, if you remember what those are like from pre-COVID, when you had those, if every social gathering you had involves alcohol, how can you break that up to show that it's not a requirement when you have a party to have alcohol, to just be willing to break those routines. Again, recognize that conflict is natural, that it's okay if there's a little bit of back and forth, and that doesn't mean that you failed in the conversation, that just to recognize that and acknowledge that that's okay. And then really encourage you to use this opportunity to build confidence and establish trust. I think Richard talked about that a little bit as well too, that to really talk about, this is how we want you to handle these things, and how do you feel about that, and what are your concerns? Let's have a conversation about it and establish the trust, build a relationship that can handle if something does happen and you're at a party and I can come pick you up, and what does that look like? And then also to get them involved. You've seen 3 students tonight that are involved in Courage. If you're in that area, I would highly encourage you to get them involved in an organization like Courage. There's Project Success, there's D-Rock in the Richmond area, Discovering the Realities of Our Community, to help them get involved, to have you get involved as well. As they're involved, as they do things like this or other opportunities, it just re-emphasizes, re-engages them in this conversation, helps them to remember why they've made the choices that they have, and they can help make a difference as well and help their friends. So really, really encourage you to help them get involved as well. If we can go to the next slide as well. And I do want to leave you with some resources. And I just saw in the chat, somebody asked what the flipping book is. And that's a great question. And then these things on the screen are them. They're parent handbooks. Some of what I've talked about tonight, some resources, some how to have this conversation, how to build trust, that type of thing are all in these handbooks. I would highly recommend them. And then I believe in the chat that you're also going to get a document that has some conversation starters and some tips to be able to use those. Has a little more, you'll see in the handbook as well, about some sample questions of like how and what and why, to give you some places to start as well. And then another resource, if you're a part of D-Rock or any of these other organizations involving youth leadership, MAD also has that opportunity statewide as far as a MAD teen influencer. We have students that are out there doing some outreach and some important work for us to help spread the word, social media posts, doing presentations very similar to this to their peers, different things like that. And we'd love to include them as well. So if you'd like to volunteer your student or get them involved in that as well, there's the email address for you to contact us and we'll reach out to you as well. So thank you all for listening to all this. I know it's a lot of information. Like I said, it will be sent out to you so you can digest more of it, but we appreciate it.
All right, thank you all so much. We were so glad to have all of our presenters tonight, and thank you all for attending as well. We're just at about 6:30, so I wanted to just quickly show you that I went ahead and recapped some of those tips for adults for each section. You will get this via email, so you can have a chance to look at it then, and as well as all the resources will be available to you and sent to you. And we also wanted to make sure that you had the resources to all the websites, as well as our website. I know something was brought up this evening about conversation starters, and we also have on our TUPE website, conversation starters for talking to your child or a young person about tobacco use. So I know that that link is being dropped in the chat box, so feel free to check that out as well. And the next event that we have scheduled is for May 20th. So please save the date, and the registration will be out soon. And we will hear more from our young people. Our Courage students will be leading that event. So we're really looking forward to it. And I think we just have our contact information. Feel free to reach out to us if you have any questions. We have our website. We're also just on Twitter at this time. And we would love your feedback. We use your feedback to plan for future events. So we have the link here that you can use. I think it's being dropped in the chat box as well. So just click on it and please provide your feedback. We did advertise that we have a Q&A session after this. So whoever would like to stay on and participate in that Q&A session, please stay on. For those of you that are not going to be joining us, please complete the survey. And again, we appreciate you joining us this evening and spending some time with us. And I am going to leave that on just for a few seconds until they're able to click on that. And then I'm going to go ahead and check in with Emily and see if there's anything in our Q&A box that we can answer.
There are two questions/comments that I think we can touch on. And Richard, get ready, because I think they're mostly for you. So the first one was around the data around adolescent use of cannabis and just being concerned with the idea that cannabis use isn't going up. And speaking from their experience in their district, that use has gone up 6% over the past 2 survey cycles, and Monitoring the Future showed vaping of cannabis doubling and tripling over the past 2 or 3 survey cycles. So can you touch on that a little bit more?
Yeah, I think my main point was legalization isn't going to lead to the skyrocket of usage. So that data we looked at was national, it's not local. And it's really important to figure out if they are doing a survey within the state or your district or school to look at that data first. I think that's the most telling in terms of, okay, what's happening? So that was my point was, yeah, it's not going to lead to the skyrocket, but young people are using. That was something the note I wanted to leave on was they are using, and it's not changing drastically. I know sometimes it's those talking points are used like, look, it doubled or tripled, but the point is, hey, what's more important? Okay, why are young people using? Yes, we're seeing this at our school, but let's talk to our young person and ask them, like, why do they think their peers or their friends are using, or what are they seeing at their school? So the data is a really good way of seeing what's going on, but what's more important is getting to the root of why the students at your school or in your community are using, and then figuring out some gaps and what support do they need. Maybe they're using because they want to feel good or they want to feel less stress. And those aren't bad things. They just are looking for adults to support them or empower them so they don't have to use cannabis to do that. So the data is important. And like I said, look at the data and use that as a launch pad into your conversation about cannabis.
Thank you. And this next question is also framed regarding marijuana, cannabis, but I think it could actually be touched on by when we're thinking about any substance use. So it's first is a thank you for sharing the valuable information. And then the question is, how to have a conversation with a teenager who maybe gets caught using cannabis or really any substance and says, well, that was the last time I used it. Maybe getting caught and saying that it's only nicotine, and not cannabis. So while the question is really around cannabis or marijuana, I think it's certainly you could fill in the blank with any substance. So anyone who would like to chime in about that. So how to talk to a teenager.
Yeah, if someone wants to talk, I'll wait. Don't want to hog your ears.
Well, I'm happy to share a little bit. We work with youth ambassadors. They're high school students with our group. We have, I think, 16 now. So our group continues to grow. And we have a lot of great, honest conversation with them about certainly all drug use and what their perspectives are. And that's one of the questions that, we're always trying to figure out, like, how do you talk to, how should a parent talk to a young person? And always they say, don't be condemning. Even though you may have caught them doing something, you need to approach it from a caring standpoint. I care about you. I'm not trying to condemn you. You're not going to be in huge trouble necessarily, but, we do have our boundaries and we need to explore whether you have a problem or not. And if you do, we're here to get you help. So it's really, just approaching it from a compassionate and really caring and just not going off in a crazy manner, oh my gosh, I found this in your room and clearly we have a big problem. You need to really just calm down and have a really calm conversation with them. That's more engaging. Nobody wants to be yelled at. Nobody, that includes us too, as adults, so.
Thank you, April. With any of our, we're privileged to have like real live young people with us too. So I'm wondering if any of you would like to touch on this as well. Like, what are some of the ways that work for parents and other adults to approach young people who might be struggling with substance use?
Yeah, I definitely have to agree that flipping out at them is probably not the best idea right about now. Like in this situation, I actually, going back to the story with one of my friends, when his parents found out, the first thing he did after they flipped out at him was he smoked more weed because he just felt overloaded. And so I definitely think, taking it quite a bit more calmly than just taking that knee-jerk reaction that I'm sure anyone would have to just flip out is definitely probably one of the best ways to go around it. Also, I definitely also try to say, as like something a little more long term, if you can find a sort of close to root cause as to why they might have started taking the drug, because sometimes it could be personal image. Say vaping is cool. I mean, you buy it off that shady dealer Snapchat, you're the really cool guy now. Maybe it could be a way to try to like cope with stress, isolation, loneliness. Or it could be something else entirely. Everybody has their own unique and personal story, and connecting with that, the reasons for starting to do whatever it is are also personal and unique to them. So I think definitely seeing what exactly the root cause is can help you find next steps going forward.
Yeah, so adding on to what Drew was saying, I think a big thing is to kind of not shy away from it and, isolate the kid or your kid or the person you're talking about. I think it's important to just like have them know that they're not alone and that you're there for them and that you're going to tackle this, whatever that means, together. Because I've seen a lot of instances where they disagree, they butt heads, and then they kind of just go off in their own ways, and then nothing gets solved. In fact, more secretive stuff comes out. It's more dangerous for the kid. So I think from my perspective, I just think it's just better when the parent or the guardian or whoever it is, the adult, is just more open to understanding and kind of like just putting themselves in their shoes and kind of navigating, obviously, like why, like as Drew was saying, why this is happening, but like what can you do better? I know a lot of people are scared of solutions because that means you're addressing the problem and making, seeing that this is a real thing. But I don't think adults should be scared of that. They should know it's something that happens and that this is something they can overcome.
Thank you so much for that. And at this time, it looks like we don't have any other questions in the Q&A box. If there's any other questions for the night, I don't think there are. So I just wanted to thank you all again. It was really good to have you here, all really experts. It was great to hear from you. And thank you for joining us. And we will stay on for a few minutes until everybody closes out. If anybody wants to ask us a personal question or stay on with us, we will be on for a few more minutes, but we're gonna wait until everybody logs off. Oh, how can you reach out to the teenager when you, how can you reach out to the teenager when you did overreact? Is a question that just came in. So if you do overreact, how can you reach out to the teenager? Anybody want to try that one?
You want to go ahead, April?
You can go, Richard. I just think you need to apologize. Just say, I'm so sorry, I overreacted, right? And let's have a calm conversation about this. Let's start over. I think that teens are very forgiving, and certainly to admit that we're not perfect either is not a problem. So I would just say, I'm sorry, let's do this again.
Yeah, I think you have to model good behavior. So in any relationship, if you overreacted, you would want to show your young person that, hey, I messed up, I overreacted, and maybe the next time it comes up, I'll know that I need to take a breather for like 20 minutes, go for a walk, and then come back and say, hey, I found this, I have some concerns, let's meet soon so we could talk about this, and not come in and start accusing them and attacking them, because it's not fair. No one wants to be in that position where all of a sudden they're caught off guard from their caregiver or their parent. So yeah, just echoing what April said.
Yeah, and I would just add, like Richard just said, to have a plan of what would take place if the overreacting starts again, but also to let the student know that the conversation needs to continue, and then maybe have them start that conversation. Where do you want to start this conversation? Now, that definitely apologizing, I love that, but also just saying, I want you to start us out and really help us have this conversation in a better way this time.
If I could just add on, I just remembered too, the Partnership to End Addiction, also another reason I really like them, that group of parents who've been trained can offer really great suggestions on how to plan to have a conversation. So not like maybe immediately having it, but plan it out to doing maybe a bit of an intervention. And on that website, the Partnership to End Addiction is a section that talks about that very thing, how to have that conversation. So a really good tool and tip there.
All righty. Lisa, thank you so much for that. So thank you so much for all of your questions and as well, and for continuing on with us through this Q&A session. Looking for any other questions, and if not, we're going to go ahead and end the evening.
I just want to say something real quick, that you can't force a young person to quit. They have to be ready. They have to be interested in quitting. So a lot of the times, if you do find something, a substance, you may say, you have to quit right now. And the brain doesn't work that way. The brain's going to quit when it's ready. So just remember, you can't force someone to do something they don't want to. And you have to motivate a young person and tell them all of the consequences of using, do an awareness session before you can move them towards quit. So that's just a really important information for intervention and for cessation or quitting, is that that person has to be ready.
Mm-hmm.
Thank you for that, Richard. All right. Thank you all for joining us. Have a good evening.
Good night.